And with the New Year's celebration just days away and the highly contagious Omicron variant rapidly spreading throughout the country, doctors are stressing the importance of vaccinations and testing.
Many people are turning to at-home testing, but health officials are warning those tests could give you a false sense of security, especially if you're doing it the wrong way. Team 12's Josh Sanders spoke with Valley physicians about their concerns with the Omicron variant and tips on how to use those at-home tests.
Inside this Midtown Phoenix CVS, Valley Dad Mike Adams finds an empty shelf. At-home rapid tests for COVID-19 sold out.
We've got 4 boys at home, and they're constantly bringing stuff into the house. And so for us, we've got 1 boy that's sick right now. So if he is positive, we got to know, we got to notify, because we had family over and friends over yesterday.
The at-home test, a hot item for those celebrating with family and friends for the holidays. But Valley physician Dr. Frank Lavecchio says these rapid tests aren't always accurate.
When you do them perfectly, get the right amount of specimen, enough specimen is very, very important. In a symptomatic person, you're still going to be right only 85% of the time.
That number when a clinician oversees the test, but he points to another study conducted in Yuma, which found nearly 1/3 of positive patients taking at-home tests by themselves receiving a false negative.
What they don't factor in is the human error.
This is basically an anterior nasal swab.
12 News went to family physician and regional director at One Medical, Dr. Natasha Bouillon, for tips on how to limit possible mistakes.
And so we insert this into the nose about 1/2 inch to 3/4 of an inch.
Dr. Bouillon says to make sure you swab for 15 seconds, using 5 big swirls in both nostrils until the swab is fully saturated. She also says hold the swab firmly.
The rapid antigen COVID tests, those are reliable, but of course they're not 100% accurate. If somebody has symptoms, but they test negative, it's still important to isolate and avoid other people because you could still have COVID.
Especially now with the highly contagious Omicron variant.
You might have a sore throat, you might have a runny nose, you might have a cough, fever, headache. Any of those symptoms could be symptoms of COVID.
Dr. Bouillon says if you do test positive at home, to listen to your body and reach out to your primary care physician.
For a lot of people, they're able to stay at home, isolate for 10 days, and many people will get better. Some people whose symptoms can get worse pretty quickly, and you should let your PCP know because you might need higher levels of treatment like monoclonal antibodies.
Josh Sanders, 12 News.
Josh, thank you.